You know, joint replacement surgery is one of the absolute miracles of modern medicine. It gives people their lives back. But there is a shadow that looms over this incredible success story, and that's the risk of a serious infection. So today, we are diving deep into what a prosthetic joint infection is, who's really at risk, and how doctors fight this invisible enemy.
Okay, so let's put this into perspective right away. Even though these surgeries are overwhelmingly successful, about 1 to 2% of them can lead to a deep infection. Now, 1 to 2% might not sound like a huge number, right? But think about it. Millions of these surgeries happen every single year. That means tens of thousands of people are left dealing with this incredibly serious, painful, and complicated problem.
So the big question is, who gets these infections? Is it just random, a roll of the dice? Well, not really. Doctors have gotten really good at identifying specific factors that can seriously ramp up a person's risk, both before they even get to the operating room and in the weeks right after.
And some of these risk factors might actually surprise you. We're talking about things like poorly controlled diabetes, which really messes with your body's ability to heal, or being on drugs that suppress your immune system, smoking, or even, get this, poor dental hygiene. Yep, an infection in your mouth can create problems for your new knee. That's why surgeons are so careful about getting a patient's health in the best possible shape before the surgery. It is the absolute first line of defense.
Okay, but let's say some bacteria do manage to sneak in and set up shop on that brand new artificial joint. What happens then? And why are these infections so incredibly tough to get rid of? Well, the answer is pretty fascinating. It's all about the amazing defense system the bacteria build for themselves.
It usually starts with bacteria that are all around us, every single day. Things like Staphylococcus aureus, you probably know it as the cause of staph infections. And then there are its cousins, like Staphylococcus epidermidis, which normally just live harmlessly on our skin. But when these everyday germs get into the sterile space around a new joint, they turn into a really formidable enemy.
See, the bacteria's secret weapon isn't just about multiplying, it's about building something. They team up to create this structure called a biofilm. And you can think of it like a microscopic city of germs, all working together, all protected inside a slimy goo that they make themselves.
This biofilm is basically an invisible fortress. That slimy matrix I mentioned, it acts like a shield, physically blocking antibiotics from getting in and killing the bacteria. And it also hides them from your own body's immune system. This is exactly why a simple course of antibiotics usually doesn't work here. You can't just bomb a fortress that you can't even get into.
So if this infection is hiding inside a fortress, how in the world do doctors even know it's there? Well, diagnosing it is a lot like detective work. It's about gathering clues from a bunch of different places to build a solid case.
Right, so there's no single, simple test that screams infection. A doctor can't just look at an x-ray and be 100% sure. No, they have to become investigators, piecing together clues from the patient's symptoms, from special blood tests, and, crucially, from fluid that they draw directly out of that painful joint.
One of the first big clues comes from tracking inflammation in the blood. They look at markers like CRP and ESR. Now, after any big surgery, it's totally normal for these numbers to shoot up and then slowly come back down. But if they stay high for way longer than they're supposed to, that's a huge red flag. It suggests there's a hidden fire of infection that just keeps burning.
Sometimes, though, the infection isn't so hidden. It can actually create a little tunnel called a sinus tract that goes from deep inside the joint all the way to the surface of the skin. If a doctor sees that, well, it's game over. That is what they call a major criterion. It's definitive proof. The case is closed.
But most of the time, the detective work comes down to a scorecard system using minor criteria. They take that fluid from the joint and they analyze it, counting the number of white blood cells, the body's infection-fighting soldiers. They look at other markers too, like alpha defensin, and each finding from the blood and the joint fluid gets a certain number of points.
And the magic number they're looking for is 6. If the total score from all those different tests hits 6 or higher, that's it. It gives doctors a very high degree of certainty that there is an infection and it's time to shift from diagnosis to treatment.
So once the diagnosis is confirmed, the mission is crystal clear. You have to get that infection out of there and save the joint. And that is not easy. It usually requires a really intensive, multi-step process that has become the absolute gold standard for treatment.
And here it is, the 2-stage revision. It's a marathon, not a sprint. First surgery, the infected implant comes out completely. The whole area is meticulously cleaned, and then a temporary spacer, which is packed with antibiotics, goes in. Then the patient gets a long course, we're talking 4 to 6 weeks, of powerful IV antibiotics. Only when doctors are absolutely sure the infection is gone does the patient go back for a second surgery to get their new permanent joint.
And if you look at the data, you can see why this intense approach is the standard. Sure, there are other options, like a simple washout or a one-stage surgery that swaps everything at once. But for those really stubborn, chronic infections, the two-stage revision has the best track record by far, with success rates up around 90%.
Of course, as with so many things in medicine, the best fight is the one you never have to have. And that's why preventing these infections in the first place is so incredibly important.
And prevention is really a defense-in-depth strategy. It starts weeks before surgery, getting all those risk factors we talked about under control. It means screening patients for bacteria like MRSA in their nose and getting rid of it. And then in the operating room itself, it's everything from giving IV antibiotics at the perfect time to using special air filtration systems and even limiting how many people walk in and out. Seriously, every little detail matters.
So, look, while a prosthetic joint infection is still a really serious challenge, the story here is one of constant progress in prevention, in diagnosis, and in treatment. But what's next? What's the breakthrough that will make this whole conversation just a piece of medical history? Maybe it's a new kind of implant that bacteria just can't stick to, or a smart antibiotic that can hunt down and destroy a biofilm. That's the ultimate goal, to make this feared complication a thing of the past.